Hi, welcome everybody, and thank you so much for coming to this session of Thriving in the Workplace. My name's Andy Anderson, and I'm an oncology nurse, and I work full-time in Maggie's Edinburgh. It's my pleasure to work in such a remarkable organisation. And Maggie's is an organisation that supports people dealing with cancer diagnosis, any stage of cancer diagnosis for any reason, both the individuals with a diagnosis, but also their family members and friends. And we've been able to really healthily and successfully run the organisation fully through the whole of the pandemic, and delighted to be able to have done that. But we're aware that that's had a significant impact on the population of people who we have supported and how they have experienced their cancer diagnosis, but also how they've experienced returning to work or being at work. And also for our own colleagues, it's been a really challenging experience. And we're really keen to follow on from our really successful webinar last April, Returning to the Workplace. We wanted to return to the topic of health in the workplace during the pandemic. While there's increasing hope that our lives may be returning to some sort of normality soon, and thankfully all of the information is moving much more towards that, the long-term stresses created by the pandemic continue to affect employees across all sectors. Our keenness is to support you, to support the well-being of your employees and your colleagues. In this webinar, we want to look at some of the issues that are at the forefront of the nation's mind, how to cope with uncertainty and anxiety, how to safely re-establish the workplace, spotting the signs of stress and offering support for that, and how line managers can support teams and build resilience. We're going to be able to hear from Catherine Davies, Senior Learning Manager at Sainsbury Bank, and Beth Husted, Wellbeing and Customer Experience Operations Manager at Unum. And we've had long-standing working relationships with both brilliant organisations about the impact of the pandemic on their workplaces and clients' workplaces and what they're planning for the future. We're also joined today by Lesley Howells, who is Maggie's lead psychologist, and she's going to be leading today's presentation. There'll be a Q&A after Lesley's presentation with Sainsbury's Bank and Unum. And during that time, you can submit questions via the Q&A button on the screen at any point. And some of these will be able to be answered at the end of the webinar. We're going to be recording the webinar to share with you and for those people who weren't able to attend today, but only the panelists are going to be recorded. So it's with huge pleasure that I introduce my long-standing colleague at Maggie's, Lesley Howells, to be able to share her presentation. Thanks so much, Lesley.
No problem. So first and foremost, we're going to do the Mentimeter poll, and you'll all be accustomed to this. And the Q&R code will come up now. If you just point your phone camera at the screen, it should take you through to Mentimeter, which again is software that many of you will have become accustomed with over the last couple of years, if not before. And you'll be given the opportunity to actually answer the question, which is really important to us because we want to create this in real time and make sure that what we're going to do today really starts to answer some of what you're up against, what the challenges you're up against. So the question that we're asking you is, what is one big challenge facing staff well-being you're concerned about over the next 12 to 18 months? Now, I appreciate there are loads of challenges, but if you could just, in the Mentimeter poll, just put up one, the first one that comes to mind, and let's see what happens when we've got 66 people on this call, and if we all do it, we should create quite a word cloud. And I always get ridiculously excited at this point, so I think my colleague Jonathan's going to start to share the screen so that we can see the cloud building. Right, so here it comes. Oh my. It's just the extraordinary nature of being able to do research in real time. This is 29 colleagues all working within health, learning, HR, learning and development, all very conscious of how to look after your staff teams. And this is what you're seeing in terms of the challenge ahead. Oh goodness, there's a lot of empathy going on. I'll let you carry on, and then I'll start to kind of draw it out. But yeah, I don't know whether you're noticing any surprises, even if it starts to build. So we're on 53 people at the moment. Just give some people a little more time. And as you'll be aware with the word clouds, whichever is the largest font, that's the one that most people are talking about, or most people are entering. We're on 60 at the moment, 61. See whether we get to 66. If not, that's fine. Right. Okay. Right. Okay, right. Well, I don't know what you guys are thinking, and unfortunately, I can't see your faces. But I think, unfortunately, there are no surprises here. The concerns, anxiety, mental health, burnout, isolation, uncertainty, and getting that work-life balance in all respects are featuring large. Right, we've got to 68 participants now, so I think we're contributing as well, or a couple of you are putting in more. So we'll stop at this point, and the opportunity will remain open, and then we'll have another Mentimeter poll at the end, another question. But I think this is extraordinary, but not extraordinary, and that's the unfortunate thing, is that you're obviously attuned to the people in your workplace and really picking up what's going on. The idea of anxiety, not only has this anxiety been going on for the last 2 years, but it is going to continue, and the potential for burnout and the constant preoccupation that all of us need to have in terms of mental health. I know my husband was doing a webinar on health and safety yesterday, and he came gleefully through to me saying, it's not about the seating that we give people at home when they're home working, it's about their mental health. And I was thinking, yes. So let's see. So we've also got in here, any surprises, we've got isolation, which we will be touching upon in this presentation. We've got work-life balance, which we will be touching upon. And not just through me talking, so I'll be setting the scene, but then our long-standing partners and colleagues, Beth from Unum and Catherine from Sainsbury's, will be giving their real-life example about how their particular organisations are responding to this. And I think the work-life balance it'll be interesting, because it's not just about the person themselves and their work-life balance, but how does their work-life balance impinge on their colleagues, impinge on your productivity, impinge on all sorts of organisational goals. The other word that's in there and quite large is uncertainty. And we'll be touching on that as well, and some of the growth that's actually come, the psychological growth that's come through the experience that we've all had. I'm just looking in there as well, and obviously we'll be able to kind of pass this out to you all. Lack of clarity, long COVID, teamwork, the big resignation. Goodness, that came up in a Guardian article in the end, latter part of last year, the idea of people just moving on for all sorts of, what for them are healthy reasons, but in other respects might be because they just can't tolerate it anymore. Okay, so I'm going to have to let that one go now and actually move on to share my screen and share with you some of my thoughts, which obviously are born of the experience of working alongside Andy as one of my key colleagues, and also working alongside the teams across the UK and the people that are coming through our doors, because they are incredible teachers for us in terms of living with uncertainty and living with circumstance beyond your control, which unfortunately is one of the things that we've all had to have the hard lesson in over the last couple of years. So although we're cancer professionals, this is tuned into the whole of society, because this is all about a tricky job of being human during this time. So what I'd like to do is, first of all, actually start with a slide that I showed you this in April, May last year. So April, May 2001. And I think I've got that right. Yes. And you can see what was writ large was my employees don't want to return to work, brain fog, psychological safety at work, the need to brush up your social skills, and turning crisis into opportunity. So that was the narrative going on at that particular time, right? And I did a similar exercise just over the last couple of months, just kind of storing different bits and pieces. Whilst I'm on here, bear this one in mind, because I'm going to come back to that for a very particular reason, the British Psychological Society guidance. So that was May 2021. And these are some of the headlines. I'll just move this on. Oh dear. Yeah, all right. So these are some of the headlines now, and some of the things which are within our papers and also within the research world. And very much this idea of burnout has suddenly become the word that's kind of coming through. It wasn't as apparent last year, but also the idea of rethinking. It's not just that anxiety about returning to work, it's about whether I want to do this work. And also the idea, this like, we think we're in a particular place where we're just about to start getting some sort of normality again, and lo, a new variant comes, and suddenly the whole of the world is upended again in terms of that return to the office. Now, I've just got my own wee world where, for various reasons, in terms of having changed job within Maggie's mid-pandemic, I'm actually more based at home at the moment, albeit that our centres are open. So I've got my experience of working at home, which I'll try not to bring in and share with you, but it's definitely brought all of this to life. And so many of these articles, much of the research out there, I reflect on professionally, but also then reflect on it in my own circumstance. So this is January, February, well, this is December, January this year. So let's move on with this in the background, okay? And this kind of continuing narrative in terms of well-being, but also that extra narrative about people, that really this idea of living with uncertainty, but also this idea of burnout, all of which you actually mentioned in that word cloud. So this time May last year, and this particular article was put together very rapidly, right at the very, very beginning. So it came out about April 2020. And although it was written for healthcare staff, the psychological needs of healthcare staff frontline, in actual fact, more and more, at the time, I thought this isn't just about those people at the front line, this is all of us. And it has become increasingly the case for me as I have watched and observed not just society, not just within Maggie's, but also in all sorts of different ways, just what's been rolling out. And what usefully, this particular document is all about how do you help maneuver staff through that kind of active stage of getting ready for a crisis, then moving into a preparatory stage where you're getting ready for a crisis, to the active phase, which is a kind of when people are heroic, there is a surge, there's a real kind of camaraderie, we will do this. Then in the active phase, moving through to this idea of you can only be heroic for just so long, and then you move into this kind of sense of disillusionment, exhaustion and depletion. You're up against a wall, adrenaline does not sustain, it eventually ebbs. And within this particular paper, they also had the idea that there is a recovery phase. So there's a preparatory one, there's the active phase, and really kind of laid out exactly what you could be doing, what to look for, and what you can be doing for your staff during this. And this is an excellent read, and I'd be recommending you to look at it. Even though it was prepared right at the very beginning, unfortunately, it is a telling story that is absolutely to the fore now. Because where is the recovery phase? Where is it? Is it going to be now? Now that there's a suggestion that we can remove some of the restrictions? Because one of the things that people have been noting, and I'm sure you've been noting in your everyday, is the on and onness of it. And I remember when I was looking at this quote, I actually misread it, because I read it as kind of the on and offness of it all, but it's actually what Amanda sorry, I just move this. What Amanda Ripley was saying was this kind of this idea of it's just carrying on, it's unrelenting. When does it stop? And I think that's an incredible kind of lesson for us all in terms of things that we can't control, and the idea that that even the guidance that's been coming out, not just from the BPS but from other organisations, are the idea that this is not straightforward. It's not linear. We're not going from prepare, active, and then recover. This is going back on itself constantly. But hopefully, and I think this what I'm doing now, I often do with clients, is the idea that even though you feel you're going back on yourself, you're going in a generally forward direction. You're never back to square one. We have got a hell of a lot of learning that we've gained through what we've gone through, which bears us in good stead for the future. So what I'm going to do now is just very quickly, I've only got a couple of minutes actually, so you won't be hearing much more from me, is talk about the fact that a lot of people have grown through this. Now, I will invite you to think about Japanese ceramics by yourself. Google the idea of kintsugi. Andy probably knows it better than me, but it's the idea that when you're broken, you have no choice. You either leave yourself broken on the floor or you glue yourself back together. And if you're going to glue yourself back together and grow through something, glue yourself back together with gold. The idea that you come through something and you're not flawed. Some of those flaws, those breakages, are actually the things which help you thrive going forwards. Wonderful metaphor, however, and many people have actually adapted and they've learned how to flex. They've learned how to live with uncertainty in a way that they've never had to encounter before. And people have grown through all of this. There's no doubt about that. Organizations have grown through it. And it's worth actually sitting down with your teams and saying, what have we learned? What have you personally learned through this? And have that sense of reflection and realizing what we have achieved amidst all the despair. And many people have learned to actually move with reality, to flex, to be present, to pause, to kind of respond aligned with their values and what matters to them, rather than be too rigid, expecting things and life to be as they want it to be and how it should be in their mind, because we all know that's not the case. And we've also learned how to open towards new perspectives, and the idea that the chapters that we thought we'd written into the future that we're going to absolutely be are not there anymore, and we're having to do things differently. So a lot of learning, but not for everybody. And I think some of these figures are really quite extraordinary. 8 million adults, 1.5 million children will need mental health support over the next 10 years as a direct result of the pandemic. And also, as we all know, is those people who are continuing to be, who were impacted initially and will continue to be impacted, are those ones with the pre-existing mental health problems, people of colour, people living in deprivation, and young people. But it doesn't necessarily mean that it's always the most vulnerable. And that's one of the messages that we want from this webinar, is look for those people that are below the radar. Look for those people who are at home, who are working from home, who perhaps are smiling on the screen, but you know that but there needs to be something to kind of just go under and find out. Because the other thing that's a big figure is that about 250,000 people are expected to or are developing PTSD at this moment, which is startling. Now, as employees, we're not expecting you to be the mental health professionals to actually go in and sort this out. However, what we would be inviting you to do, and I will be quick, guys, is to really start to think around burnout and what that looks like. So it's that kind of the idea of people being depleted, but also being quietly so, not just cynical on screen, not just obviously exhausted, but what's lying underneath. And what we wanted to do, and what Beth and Catherine will start to talk about, is the idea of creating the conditions to thrive. And there's nothing new here, guys, nothing new. Obviously, there's a step care, there's kind of actual psychological intervention at the top for a small proportion, but the majority of us will get through it by people in your positions taking a visible but proactive leadership in starting that honest, open dialogue, really giving those conditions to thrive, but also to have these particular values to the fore of clarity, making sure you're clear in terms of your expectation of your employees and what you can give to them, but also being creative around how you can help them adapt to going forwards, and the things that you flagged up in terms of the clouds, how you can do that with balance, but also fairness across the board in terms of all of your employees. And these are the kind of these particular conditions are simply said by me, but are absolutely important in terms of you maintaining the quality that you need in terms of whatever you're doing, but also good governance, productivity, and that psychological well-being for all. So a lot of the slides that I'd prepared are actually in the webinar from last year. So I would invite you to go back or if you you weren't there, to re-watch it and really think about how can I bring my conversations to life? How can I be proactive in finding out how people are? But also, how can I be bringing teams together? And we spoke about that then as well. But also, it's how can I thrive as a leader, manager, a colleague? How can I make sure that I'm thriving again? And again, we touched on that in the last webinar. But one thing that we're doing differently this time is bringing in the experience of other people in terms of Beth and Catherine. Because what we know in our centres, if you can hear the story of somebody who is in a similar situation to you, that is one of the most powerful ways of actually putting things into place to change and take on a challenge. So I'll finish now. That was very rapid. Sorry for being over, but I'll stop sharing my screen and let Andy take over. Thank you.
Thank you so much, Lesley. And as you say, just referring back to last year's presentation, that will be available for people to be able to watch and to be able to look at these slides. So much of what we've been able to experience as a team in each of our centres in Maggie's is exactly what Lesley talked about in terms of that sense of community. The isolating impact of the pandemic has been really profound for many people, and being able to be alongside and to feel connected with and together is one of the ways in which people have started to thrive. There is undoubtedly trauma and upset and anxiety and overwhelm, as we saw in the initial slide from all of you. And I think there needs to be an honesty and a frankness about that, as you've rightly described, Lesley. This is now how people in their recovery still pay attention to that, but also think about what thriving is and what the organisation has done to be able to change and modify. And hopefully those are real growth moments for you as organisations. And we're really keen to be able to hear both from Catherine and Beth. Thank you both for being able to join us this afternoon. Really keen to hear from both of you about what you would name as one big challenge facing your organisation about long-term well-being of your staff, and what solutions you've brought in to try and address this and support your colleagues with. Who'd like to go first?
I'm happy to go, Andy, if
Thanks,
that's okay.
Catherine. Please, yeah.
So from a Sainsbury's Bank perspective, I think, and Leslie's touched on it, the word cloud touched on it, it's mental health, and every kind of facet that comes alongside that, whether that's isolation, anxiety, depression. This has been a challenging 2 years for all of us, and we can't underestimate the mental health impacts on people. As you say, as Lesley touched on, those who had underlying conditions and also those who've never experienced mental health issues and are starting to experience those now. From a Sainsbury's Bank view, we have, is that actually Sainsbury's group-wide, as well as the bank, brought in the ability for all colleagues to download the Unmind app. So that was the provider that we went with for that, which gives colleagues the opportunity to access tools both inside work and on their personal mobile phones whenever they want to, whether that be something like meditation or mindfulness, right through to directing them towards our partners, Validium, who will support on a more targeted basis. The other thing is that we've done is really to face it head on. So not to kind of push it to one side or think, this is a challenge, there's nothing we can do about it. We have invited in celebrities, famous people. So Davina McCall was one that came into Sainsbury's Bank last year to talk about mental health. And those kind of opportunities enable colleagues to feel like they can open up because they see somebody like them. They're able to hear somebody else's story, which is again part of what we're doing today as well, and really help them to share their own stories with line managers, which has been really important. And I think in terms of solutions going forward that we've not done as much yet, I think we've done a little bit, but I think more focus on line manager capability around having conversations on mental health, being able to spot some of those signs, without the individual actually having to say anything, being able to ask those open questions comfortably, and having that discussion. And then, as Lesley mentioned, not being, the mental health professional, but actually being able to point them in the right direction. So those are some of the key things for us.
Thank you so much for giving that summary. And I guess, although the pandemic is the thing that's brought all of this into very sharp focus, all of the subjects that you've just named were present pre-pandemic. These were all, our mental health is something that sadly, historically, we didn't talk about very well, and we were somewhat uncomfortable about naming in a workplace. So maybe part of the whole thriving element of this is that actually there's a different culture within workplaces. There is an honesty and a transparency and an ability to be able to say, today I'm struggling, today this is tough, and what support can I have? And that's more of a unified way rather than potentially feeling like you might be criticised or dismissed. Thank you so much for saying that,
okay,
Catherine.
Thank you.
Beth, what about yourself at Unum?
Thriving is a big word that we've just heard. And I'm not, so first of all, let me just caveat this. Our wellbeing consultant is actually on the call today, so I'm not at any point going to pretend that I'm talking about Unum's wellbeing. I do, due to calls with Nicola, and they're doing lots of brilliant things within Unum. I'm just in a really unique position in the role that I play, is that I support the well-being of all of our customers. So that's everything from big, large businesses through to really small, tiny ones. And so I'm just going to kind of share, I think, very much similar stuff to what Catherine said, but things that I've actually seen from a variety of different customers and employers over the past couple of years. And one of the biggest things, because you said about the biggest challenge kind of long term for well-being, and I actually think there's a lot of concerns about long-term health conditions. So the situation that we're in right now, how can that be playing on people in the longer term? Obviously, we've talked about mental health, but also we need to talk about the health in general. We will probably cover it a bit later, but there's the whole concept of when we are working from home a lot more, and more people are, we are not moving as much. We are not possibly sitting in the best seating as we probably could. We are often prioritising working longer hours. We're not necessarily engaging with as much activity. If we compare our Fitbits now to what they were 2.5 years ago, the steps are massively down, the movement is massively down, and that isn't just that impacts mental health. Our thoughts, our moods, our feelings are really all intertwined. And one of the things, it's interesting everyone said thriving, is I had been on a thriving workshop this morning. So Nicola, who is on our call, who is the wellbeing manager for Unum specifically, has got every line manager within Unum to attend these thriving workshops. There is stuff for staff, but this is specifically for individuals and for managers. And it's really looking at those things that are preventing you from being as well as you could and looking after yourself, the things that you can do to be able to look after yourself. But that moves in really specifically with the things that we do for our customers. So we're seeing the long-term health related issues, the socialization, hours. So people's hours could be creeping up, or they could be savvy about their hours, which could be a good thing, and they're using their time to make sure that they do get a workout in the middle of the day, because who wants to go out and it's cold and miserable in the evening, and they're actually thinking, I'm at home, I've got flexibility, I can use it. Or most people are generally just, I don't have a commute, so I can work longer, earlier and later, and that's not ideal. Less movement, less culture of engagement, because in that big resign, it was me that had put that in there. So many people are now not necessarily engaged with the culture of their business. they're removed from the culture of their business. They're in their own four walls every day. They don't need to be engaged with a particular company set of values. I could do this job anywhere for anyone and earn more money. And so they're not engaged with that particular business. And that's not great for well-being either. High turnaround, high workloads, low kind of group cohesion can really have an impact. So sort of things they've actually done at Unum, and I love this idea, is a thing called a faux commute. So this is for the next month. We're all having to post every day. It's obviously motivated by prizes and stuff, but everyone's meant to be getting involved in a faux commute and posting about it and talking about it, just to really get that movement improved. There's going to be an award for the most motivational and inspirational. I'm saving my summary for then, because I'm going to win this. So that's like, but any movement challenge whatsoever, because mental health is massively impacted by what we do from a physical perspective. Catherine mentioned about line manager training, and it's basically all that kind of top down. Line managers, senior leaders need to be bought into making people feel better at work, being more engaged at work, so on and so forth, and well-being workshops, etc. Not just plug in the stuff that Unum do. You can get these from other providers or anywhere. You don't have to use these ones, but those are things that we have. They're not once and done though. So it's not just a matter of doing a workshop and then everyone knows what they're doing. There has to be that kind of whole strategy approach. Mental health, or we do a workplace health and wellbeing review. So we're looking at the data points, we're looking at the line manager skills, the culture, the sorts of things that are available for staff in terms of healthy workplace, etc. And then really working towards making sure that your wellbeing and health strategy are robust, fair, looking at all of kind of those key domains of wellbeing, etc. And something that we added into our portfolio specifically because of COVID. We're not getting rid of it, but we got it, now we've realized it's a really good addition. But we're doing a thing called wellbeing checks, a kind of like little MOTs, little check-ins with individuals. How are you getting on in terms of your energy, your motivation, your mood? What are you doing in terms of, workplace wellbeing strategies, home wellbeing strategies? What's the efficacy of that? Like, how frequently are you actually doing it? And how effective is it? Because if you know it's great, but you're not doing it very often, that's kind of your solution there. And they're kind of one-to-one coaching sessions. They're not just for Christmas, they're for life. We will continue to do them, but they've been really successful, kind of proactively looking at your well-being.
Brilliant, thank you. And I really like what you describe about that combination approach of the physical component of the well-being of your staff, as well as that mental health. And obviously, as you referred to, people's mental health is so wrapped up in their physical health also. So I'm glad that you've introduce that, and I'm glad that your competitiveness means that you're going to smash the commute to work, or the full commute to work. I'm glad to hear also that it feels like it's successful. How did people engage with that new language, or an emerging language of checking in, and that mini health check, the well-being checks as you described? Did it feel like an easy transition into that, or were people a bit hesitant at the start?
It's interesting actually, because we're just going to change the way that they're opened up, because we originally had the access point through HR. That's the normal way any referral comes into our service. You alert yourself to your line manager or HR, they'll make the referral for you. But we found that there was a bit of a resistance to let your business know that you wanted to have a check, even though it's a positive thing. You're not the prerequisite of of asking for a wellbeing check is that you have to be at work. You're not off sick, so you're fine. You're just not probably in the peak of your thriving, and you want some support. And so that was quite an insight, because I just thought, God, these will fly off the shelves. Everyone's going to want one, but nobody actually wanted to know wanted anyone to know that they were having it. So I thought that was quite interesting.
Yeah, it's interesting. Hopefully there's a growing confidence that is about maximizing health, maintaining your health, wanting to be able to stay well and healthy at work, but it may take a bit more time for people to get confident with it. Keeping the well and having no stigma about it. That's exactly the main thing. And to both of you, what about that very specific population who have joined organizations in the midst of the pandemic? So they've never been to an office, they've never physically met any of their colleagues, they've never been in a group meeting or a team meeting. What are the things you're thinking about in terms of them being able to come back into workplace, or be able to adjust to some of that impact, and how they feel connected and together with their teams in workspaces? Catherine, what's your thoughts on that?
Yeah, I think it's a really tricky one for colleagues who haven't had that opportunity to sit face to face with some of their colleagues, and perhaps not even their line manager that interview, but it might have all been done virtually. I think what we have found has been really important is to have our virtual welcome programme every week. So that moved from monthly at the start of the pandemic to weekly, and we shortened it down with a real focus on our valued behaviours, which was we had new valued behaviours launched last year, which has been great for bringing everybody together. So that's one thing. I think really early check-ins with people, making sure that they feel like they know what the organisation's about and what it's like to work here. I think for those who are anxious about coming back into the office, and I do have a number of colleagues who feel like this, communication has been absolutely critical. So making sure that every colleague is aware of what the plan is for return to the office. So at Sainsbury's Bank, we went back in September, and obviously then just before Christmas, stopped that again with the guidance in Scotland. But it's about letting them know when they can come back, what that's going to look like, what it's going to feel like. Having building tours was another one for our colleagues who've never been in before. It sounds really simple, but it's a great way just to make them feel like they know their environment. And then doing things, starting off really small. So let's not get the whole HR department together. Let's get the learning team together. Let's get the talent team together and see, because it's a smaller environment, less people, but a chance to kind of get to know and have those allies in the room rather than coming into, a big meeting or a team kind of full department meeting to start with. And I think for me, what's really important as well is letting colleagues know that actually sometimes it's okay to not want to come face to face, enabling them to have that opportunity to say, actually, this doesn't feel right for me at the moment, so I'm not going to come to that, but I will interact in a different way, or I will give my input in advance of this meeting. And then managing through that with them. So, when it comes to the next time this opportunity arises, saying, why don't you come in for a little bit, you can meet people for a coffee, and just, trying to make sure that people feel safe in their environment. Here in Scotland, obviously we've had, slightly stricter, regulations than in other parts of the country for quite a lot of this. So we've had that balance between colleagues who are in London and have enjoyed, a lot of freedom in the office and that, and in their kind of lives, versus us in Scotland who have been that little bit more cautious. So again, it's that balance between not throwing people in at the deep end, but letting them take their time to come to it.
I like that kind of balanced approach of really listening to the individual's pacing rather than feeling obliging them to go at a particular pace. Beth, what would you say to that similar question for those that have joined during the pandemic?
Well, interestingly, I've heard quite a lot about psychological safety and the fact that when people are joining, because they're joining virtually, they're not joining and then kind of meeting their manager in person. Because of that reason, they're not necessarily aware of how much they can bring their authentic self to work. They're not necessarily feeling safe enough to be who they want to be with regards to their gender, their sexuality, any of those things. Even if they have, a well-being issue or a long-term medical condition, you can't test those boundaries as easily when it's virtual. So I think that's a really, really big part. And so all of the things that Catherine was just saying about what you could be doing to support that, we need to be thinking as to the why. It's not just about that kind of they're new and we need to make them feel welcome. It's about the why is to create that psychological safety. And you can do, there's all the things that you've just spoken about, but things that we've seen are really successful is that kind of coffee roulette and making sure you've got that kind of buddy, the peer group stuff, making sure that induction programs are absolutely spot on, that that they're getting to meet everybody. And the thing that you don't get to build up in the business is when you're virtual is that network. Every call is very much, let's just talk about the call. You don't build up any relationships with people. So almost like role modeling that and sort of giving the opportunity to just have that kind of chat that you would normally have on the way to the walk to the meeting, because then you go into the meeting and deliver it. But otherwise, we're just here in these meetings, having the conversations and then leaving. And people are just losing that kind of relationship building piece. So that the mentor and the buddy and the induction are absolutely vital. But on top of that, the last thing that I would say would be, if we think about those line manager standards, those line manager competencies, and the importance of having those skills as a manager. If you don't have those skills, you're not going to be conducting those effective one-to-ones. You're not going to be able to have those open conversations about people's health and well-being, and that can really negatively impact those new starters. So it needs to really be looking, in the mirror, not in the magnifying glass, when it comes to the managers and their skills and competencies.
Absolutely, and hopefully organisationally making sure that the resources you're looking at for the whole team and the employees is just as available for managers and senior managers, because everybody's impacted by this.
Yeah.
I know both of you referred to it within previous answers, but what do you think hybrid working looks like? What do you think the next few months or the next year is going to be like in terms of hybrid working, and what are the pros and cons of that? But how can that really help people to thrive? What would you say, Catherine?
I think the hybrid working that we had when we were able to go back to the office up here in Edinburgh last September for those few months was a real step forward from what it had been during the pandemic. So I think most of our colleagues are telling us they like a bit of time working at home and a little bit of time working in the office. So that has been hugely positive, that we've been able to put in place a structure and technology that enables most colleagues to do that. Not all of our colleagues can work from home, but most can. So I think from that perspective, being able to manage your work-life balance has been positive. I think, though, we do see a lot in the news and on articles on LinkedIn and things like that, that people actually are spending a lot more time working. I think Beth referred to that earlier on in her question. So starting earlier, finishing later. Some people don't have the luxury of having a spare room to work in. So, suddenly their living room becomes their workplace, and it's very difficult to get away from that. I think, broadly, what we're seeing is that colleagues are enjoying the ability to make their own decisions about what is right for them. I think that was a challenge going back to the predominantly working from home in kind of November, December time up here, whereas colleagues have got used to being able to come into the office maybe 2 or 3 times a week, checking in with people, having those water cooler moments and cups of coffee together. So I think, that with the kind of the pandemic and the way it is, and Lesley referred to that at the start, with it kind of going on and on, there'll be these waves of going back in, coming back out the office, going back into the office. I think that is particularly damaging for colleagues. So what we've tried to do here in Sainsbury's Bank is, for those particularly who are probably at risk of isolation, who are living on their own, maybe don't have family close to them, is saying to them, it is okay for you to go into the office. We can support you to do that in a really safe way. Most of our contact management centre staff are there, so there are others in the building at the time. So it gives them that opportunity to have a break from their 4 walls. So yeah, I think for us, again, though, it's very much a watch and brief with this, and following the First Minister's guidance as much as we can, of course, but making sure those workspaces are still available for those who are at most risk.
Absolutely, it's such an important point, and very clearly an issue we've seen at Maggie's across the pandemic, also of people being in home much more, for created all sorts of challenging situations for them. Beth, what about yourselves and what you've seen across Unum and companies you work with?
I would say the thing with the hybrid working specifically is, the word that jumps out at me is the juxtaposition. It's just a massive juxtaposition. You have the working from home, which everybody who was ever forced to work in a location absolutely wanted to be able to work anywhere. I had a massive travelling job before this. We were talking about it before the session started, and me and my team went out and about all the time. And so the idea of working from home was like, oh goodness, it's nice to be at home and have the option. Now we all feel like kind of trapped birds and need to spread our wings and fly. And I think that's the thing with the hybrid working, is that it needs to actually be hybrid. So the autonomy that Catherine was mentioning, that's where it's going to be most successful, is where people make it work for them. They get engaged in their non-negotiables, the things that are really important for their well-being. They make sure that they're moving enough. They make sure that they are conscious of their hours. They're using the time at home effectively. You know, if you're going to have a lunch break, make the lunch break work. Get out and about. Don't sit inside the house, or watch a program that you really want to watch that the kids can't see, and you can do it. Like, make it work for you and make it as effective as possible. And then you're not going to be stuck in that kind of I'm not where I want to be with it. What do you need? How can you make it most effective? And I think that's the important bit for us to be supporting our staff to do.
I really like that as a summary, and I think what you've both been able to really brilliantly articulate is how to be honest about this, how to be present about these issues, how to speak it rather than to assume it, both from a manager's point of view, but also from an employee's point of view. All of these issues need to have more space to be spoken and more space to be aired, so there is more of a confidence about combination of physical, but particularly mental health, and also in terms of returning to work, how people feel engaged with their work, how they enjoy their work, how they bring their energy to work, and that they feel part of a community. Work is often a place that we spend a large percentage of our life, and it's worth doing it in a way that feels enjoyable and connected and engaged with other humans. That sense of community that Maggie's has been so successful at being able to provide, the alongsideness is such an integral part of what people find beneficial about the centres, and hopefully that's something that can be regenerated in your workplaces. Thank you so much for being able to look at those questions with us. Really keen now for all of you that are part of today's webinar to be able to post any of your questions. There are a couple of questions that have come in, but if any of you have got any questions, please use the Q&A function to be able to ask anything of us. If you don't ask anything of us, we will have our own conversation, and hopefully we'll try and make it as relevant to your circumstances as possible. If I just open up, first of all, there was an important question somewhere about kintsugi. Somebody had asked about Lesley's reference to the Japanese repair. Partly I'm really keen to answer it because two of our team from Maggie's Tokyo are on the webinar today, so it feels even more important to give reference to it. So it's kintsugi, K-I-N-T-S-U-G-I, and it's a really beautiful philosophy of taking care of self, but taking care of change, and looking at things in a way that can actually demonstrate that growth. So when Lesley discussed post-traumatic growth, hopefully that's a phase that we're all starting to look at. This has been a traumatic and complicated experience. The growth that can come from it is deep and profound, and one of the beautiful things about kintsugi is it leaves a permanent measure of that. It leaves this beautiful gold measure of the change that we've gone through. Looking at another question, Eileen has put a question: with so much focus on all staff, how can we prevent cancer survivors, vulnerable staff, those with ongoing health issues, being lost and not considered with everyone? It's an important point, given that some people will come into this experience with very complex pre-existing health issues, or they may well have had health issues in the midst of the pandemic. What would either of your responses be to that before Lesley and I make mention of it?
Sorry, I had assumed that Lesley would answer that because that's so up her street.
It is. It's right up both Lesley and I's street. But I'd be keen just to think about, from both of your perspectives in workplace, is there any element of recognizing where there's been pre-existing health issues or health issues that have come up, and then the complexities that adds?
We specifically focus on things like wellness action plans for individuals living with long-term conditions. It means that there's a constant ongoing dialogue between the employer and the manager, or potentially HR, and you are talking about key areas that could be of concern. Those individuals are particularly vulnerable to, or susceptible, I should say, to the impact of everything else, greater so than the all staff population.
Mm-hmm.
So I think, to me, it would be using a tool such as a wellness action plan to keep that regular dialogue open for those particular individuals.
Mm-hmm. Thanks, Beth. Catherine, anything to add?
I think, having not experienced this personally as a line manager, I think though what is really critical again comes back to line manager capability in this space, knowing your colleagues, being able to have those discussions openly with them, and also recognising that not one size fits all. So, we have things like, most organisations, of course, will have, absence triggers for people who've been off for existing periods of time. That's not always going to be the right thing to invoke disciplinary action for for certain situations, and they should be dealt with for each individual. So I think it's line managers understanding that they it's important to really have those honest conversations with their colleagues, get to know them and their circumstances, and then being able to reach out and actually know the right steps to take after that, whether that is getting support from our employee assistance provider, or speaking with one of our ER colleagues or somebody like that to support them as a line manager, so they can provide the best support to their colleagues.
Yeah. Just to add into that question, there's another person who's anonymously posted saying an employee has a cancer diagnosis at the start of 2021, so right in the midst of pandemic, and has had surgery, chemotherapy and radiotherapy, and they're intending to return to work in a phased return, and looking at tips on how they help them get back into a complicated workspace as a teacher, looking at COVID risk and other elements. Lesley, from our point of view, I know that that's something that we spend a lot of time supporting people with at Maggie's. What guidance would you give to the colleagues to be able to offer some support back into that workspace after a cancer experience?
Yeah, I think first and foremost is actually to listen to all that we've been talking about today, because all of it applies. But also the idea that it has to be bespoke and never make assumptions. So the importance of actually having those conversations in terms of, we're keen to support you. How can we support you? How can I help you? Be as honest and open in terms of what you need, in terms of actually coming back in and really doing that kind of that pacing, and using natural breaks, just like, for example, the February half term, the person doing that kind of rehearsal of coming in, and really it being a kind of an opportunity to discover things which they perhaps hadn't realised would go well, but also some of those things that they hadn't realised would trigger anxiety. And I think what Beth was saying about the wellbeing kind of pathway or checklist is something that also Catherine echoed, and I know Andy, you and I will always be advocating with anybody that comes through the door, is look, where possible, you're not going to lose your job, but that's a natural anxiety, but try and be open so that your employer can actually support you, because it's in their interest to support you. Because they don't want to lose a loyal employee, but also there's cost in losing people. And I'm sorry to make that sound so kind of clumsy, but don't assume that your employer is going to be anything other than actually accommodating and trying to help, even if unwittingly they get it wrong sometimes, is actually still kind of still look to them to be your main support. Don't know whether I've answered that, Catherine, Beth, what do you reckon? Have I answered that okay?
Always.
Yeah, I would agree. I think, again, as has been highlighted, is that constant open communication. And just as you've named, Lesley, our encouragement for anybody that's coming to Maggie's is to continue to be open, to name what you feel your needs are and how different they are. Try not to over assume your ability, and to give yourself permission in terms of that recuperation, but also for employers or line managers to be curious. Don't assume, don't make the assumption, and work with the individual, just as Lesley's described. And I think one of the challenges going back into a school with COVID around and somebody who feels immunocompromised, it brings extra challenges, and just giving people permission to be able to continue to use masks, to continue to hold distance, to continue to use sanitizers. But it is challenging. It's challenging to go back into those busy spaces, particularly when you've been in quite an isolated position during treatment. For anybody in that circumstance, please encourage them to make use of a Maggie Centre and to give them that extra bespoke coaching in relation to their cancer diagnosis. Yeah,
please encourage them to come into Maggie's, because we can just pick it up and run with exactly that dilemma. And also we can do it in a blended way. Yeah. So obviously it's really important to get people into the centres to speak with, for example, Andy or equivalent across the UK, but also then we can flex and perhaps do a hybrid of actually online or telephone. Right.
There's a couple of specific questions. Question for you, Catherine. Have you had any issues around staff who can't work from home versus staff who've been able to work from home? And if so, how did you deal with that? Any particular challenges for people who can't work at home?
Yeah, it's a really good question. Yeah, so as I think I mentioned, it was mostly our contact management centre colleagues couldn't work from home purely because we still don't have the technology to support them with that. So what we actually did at the kind of height of the start of the pandemic for those who were of an age or had existing health conditions is we supported them to do other roles from home. So still working, but not in that environment. And of course, everything was socially distanced in the office, but there was that recommendation for those initial 12 weeks for them to stay at home. I think since then, whilst we've never had any issues with anybody complaining about it or being unhappy about it, I think what we have tried to maintain, even when we went back in September for all the rest of the colleagues, was that the contact management centre remained much more socially distanced than other areas of the business, because we knew they were coming in every day. They were travelling, which most colleagues were working 1 or 2 days in the office, so it was slightly less challenging, I suppose, for those colleagues to take that time at home if they needed it. So yeah, I think it is difficult. It's a difficult message to share, undoubtedly, when you have to say, sorry, despite the fact that 95% of your colleagues are at home, you can't be. I think trying to support colleagues who need to be in the office by doing the right thing by them, in terms of making it an even safer, than the basic instructions and guidance, has been really important. And also taking into account, as I mentioned, those existing health conditions. So if that person really should be working from home, then making sure we can facilitate it.
Thank you. Everybody, there are a few more questions that have come in, but very sadly, we're coming very close to 2 o'clock, and I'm sure most of you have scheduled time afterwards. There are a couple of questions who people have your names with them, so we'll try and attend to those questions specifically afterwards. I just want to say a huge thanks to all of you for coming today and being part of this really important discussion. It is going to be an ongoing discussion, certainly for the rest of this year and possibly longer. But before we close, I think, Jonathan, you're going to put another Mentimeter QR on the screen. This one, we're really keen for you to be able to use a word of what you'll take away that's inspired you from this session, if you're able to do that. As you're considering that, this type of work for us, myself and Lesley, is vital. We spend a lot of time in the centre speaking specifically about cancer and supporting people with the issues that are raised for them or for their family members around their cancer diagnosis. Thankfully, a huge amount of people who we support are in a position to healthily return to work at the end of their treatment, or are able to work alongside their diagnosis, and that's a growing population. But it brings its own challenges for the individual, but also for you as employers and line managers. Maggie's, as an organisation, is really keen to work with any other organisations to be able to give the best guidance and best support. And please do make good use of us in any way that you can. And here we are with the Mentimeter. I'm delighted to be able to say it looks quite different to the first one we saw, which is a very healthy, honest account of the complexity of what people have experienced in the midst of pandemic and what they're experiencing. But lovely to be able to see that connectedness, positivity, confidence, support, and understanding are standout words within that, and many other really important, valuable words that I would really encourage all of you to be able to think about how you bring into your daily practice at work. How, as human beings with human beings, we share compassion for one another, we make sure that's a reciprocal process, and that we continue to be able to help each other to thrive as much as we possibly can. And that's what we're trying to do for each other at Maggie's, and that's what I would encourage you to continue to do for each other in your own workplaces. Thank you so much for attending today. Thank you so much to Lesley for your presentation, and really importantly, thank you to Catherine and Beth for sharing your experiences as well. It's been a pleasure to have you with us. Thank you so much.
Thank you.
Bye-bye, everybody, and see you for our next webinar. Bye-bye.